But I'm Heather DeMar. I'm the director of Experiential here at Western New England University, and I am really excited to introduce Marie Charbonneau, who is an assistant professor of pharmacy practice here at Western New England University. She did her PGY1 residency with Big Y and then her PGY2 ambulatory care residency in Rhode Island. Today, she's going to talk to us about SBI, which stands for Situational Behavioral Impact. And without further ado, I'm going to turn it on over to Maria. Welcome,
Thank,
Maria.
thank you. Thank you for the introduction and thank you everyone for being here. I recognize this is likely your lunch break, so thank you for joining and hopefully we can learn something together and that you leave feeling a little bit confident trying this framework. So with that, I'm going to share my screen and hopefully you see what I see. Da-da. All right. If you could give me a thumbs up that you can see. Perfect. All right. So it's we have 30 minutes together. I know this is a pretty intimate group, so I'm really hopeful that this can be more of a conversation and that you won't hear my voice the entire time and that hopefully it can be um, some back and forth among all of us. But my thought with this, when Heather asked me to talk to preceptors, I went through a couple of ideas about what do I want to talk about for a half hour. And ultimately, I settled on this feedback framework that you can essentially use as a script. It's really meant to be very short, which is hence the 2-minute script thought process here. And we'll go through what SBI stands for and how to implement it, but that's just what we're doing. All right, so with that, I'd like to start by opening it to the group. I have been precepting for, I think, 4 years. I was trying to go through in my head how many students I've had. I take 2 students per block, and I usually do about 3 blocks per year. And I've been doing that now, I think, 4 years. Time has a way of speeding by. Uh, but I think that's what it's shaking out to be. And I've had the whole gamut. I'm in an ambulatory care setting in primary care, and I've had the gamut of students in terms of interests, in terms of um, some real rock star performers, so to speak, quote unquote. And I've had some students who've really struggled on my rotation, and I've tried to find some correlation, and perhaps I found some patterns, but nothing where I can concrete say, okay, this is exactly what's going on here. But I also have done some reflecting, and I've realized that I, as a preceptor, have gotten better at giving feedback, but it's still something that I struggle with. And I think that may be a universal pain point for preceptors in some regard. And that's really why ultimately I decided to discuss this for my lunch and learn. So I'd like to open it to the group. There are only a few of us on here. Would you please be willing to unmute yourself and provide some thoughts here? Why is it that feedback fails or sometimes fails? What are your thoughts with this? And there's no right or wrong answer, so please don't be shy.
I think I can go first. I'm currently having this struggle right now with a student. I feel like it's defiance or like they're like blocking where they don't think that they acknowledge they're doing it wrong, but they want to try and like argue back where maybe they are trying to show this other way of like, okay, yeah, I see that I'm doing this wrong, but this is how I'm trying to mitigate it while you're trying to give them feedback and it's not working. So it's almost kind of like being defensive. That was the word I was looking for.
Yeah, yeah. And I've certainly seen that myself in the few years that I've been doing it. And I'm sure some of you on this call have been precepting for far longer than I have. But defensiveness is definitely a barrier. Absolutely. Thank you. Thank you for breaking the ice. Other thoughts here?
In the chat from Amy up in Albany, she says feedback is seen as criticism.
Okay. Yeah. That's a big issue that I found as well. I tried to start off my feedback by saying that feedback is a gift. It's a gift to give, it's a gift to receive. It's never meant to be harsh, but it is to help us learn and grow. But we still hear that common theme of defensiveness. And some things are hard to hear. That's just the truth.
I think sometimes there's a lack of self-awareness. Like you may, say you're having these issues or communication or whatever, and the student may have no idea that that is even an issue for them. They think they're great at communication. They think that they do great things. So um, I think sometimes it's just lack of self-awareness.
Yeah, that too. And certainly we're working usually, typically with younger students or students of the typical, I'll say that with quotes, typical college age. So 22-year-olds, 24-year-olds. Certainly we can have older students and older learners, but it could be a function of age as well, that you just learn and mature as you go through life and experience more experiences. Any other thoughts with this?
Yes, Maria, we also have in the chat, uh, sometimes preceptors are hesitant to deliver negative feedback or constructive criticism, or they're at least just uncomfortable with it.
Sure, absolutely. And so up until that comment in the chat, thank you for sharing. The we had mostly brought up things that are on the part of the learner, that the learner may not be receptive to the feedback, that the learner doesn't have self-awareness, that the learner is defensive. And all of those things are very much potentials. But on the other side of the coin, from the other side of the coin, it can be that we, the preceptor, or we, the mentor, might not be giving feedback in a way that's effective. And so it's really a two-sided equation where we also have to be looking at what is it that we're doing? Is it because we're too hesitant? It's not direct enough? Is it that well, in fact, and I'll give you some examples. Let's go to this next page. These are things that I personally have heard either directed at me and my mentors, my preceptors giving me various comments, or it's things that I've heard in my role as preceptor, and also some things I've also personally said to my students or my learners potentially. So this is just an array of some comments. So what are your thoughts with this? Comments like, be more confident, watch your tone. Great job. Good job. That was great. This needs improvement. Be more proactive. Keep doing what you're doing. You're doing a good job. Or the dreaded, your documentation is too sloppy. Thoughts on these types of comments?
Kind of vague.
Okay, vague. I definitely agree. Any other thoughts? Let's go with the first. Be more confident.
I was going to say, Amy Mitchell Van Steel put in the comments that she wonders if it's not feedback the student wants, but words of affirmation.
Okay, sure. Sure, that's certainly an option. That not necessarily feedback, but can be words of affirmation. Though you could argue that for some students, they need that affirmation to help build confidence. And if you truly felt it was a good job, then it's worth saying something. But I can certainly agree. To me, be more confident is kind of subjective, right? I may think that wasn't confident enough or the tone wasn't confident enough. And someone else grading the same student or looking at the same learner might feel that it was. It's a kind of subjective issue. Another thought too is that with things that are subjective, it can be personality based, where you just might truly deep down, you might not say it out loud, but the truth might be that you just kind of struggle with the personality, and that for feedback that's subjective, it can be personality based, and then it's no longer fair and it's no longer uh, professionally appropriate for that student. Do any of these offer ideas for improvement, specific actions for improvement? Yes, no, maybe. I can't see the chat, so Dom, if you wouldn't mind.
Oh, it's good. Yes. So Amy asks, like, do we need a script such as, I like when you do blank during rounds. I think you can improve by doing XYZ.
Yeah. I love it. You're spoiling my lecture, but that's exactly what I wanted. So thank you. But yes, that's the thought, is that you'll be able to walk away with a little bit of a script to help put things into a framework. The idea behind a framework is that it offers structure so that it's really not going to be personality based. It's not going to be subjective, and it certainly won't be vague. Because I think that's often, more than anything else, especially if we're hesitant or we don't want to hurt feelings, we tend to over explain or over, well, you did this, but also and this, and also keep in mind. And by doing that, by teetering back and forth, ultimately the end result can be pretty vague. So from there, how can we ensure that our feedback lands and sticks? And that's really where we're getting into this thought of having a framework for ourselves as preceptors, so that we can really go through and make sure that our feedback lands and sticks. Because ultimately, at the end of the day, we want our students to be able to walk away from our rotation in a stronger position than when they walked in. We want them to be that much closer to practicing on their own, to be working professionals, and ultimately our colleagues, where we can call on them and say, we have a question, can you help me with this? And that we trust them to be able to do the role of a pharmacist, or if you have other types of learners, that they're able to do that role in a professionally appropriate way. So this leads into this framework that I encourage you to think about and maybe try moving forward. SBI is the acronym to help you remember. So with S, we have situation, B is for behavior, and then I is impact. And the idea with this is that it provides a framework so that way you can say specifically, during this specific moment, and that's the situation. You set the scene and have them recall exactly what situation exactly you're referring to. So during this specific moment, during the interaction we just had with this patient, or during when we were in the patient room, whatever it is, set the scene for them. And then tell them what you noticed, what the observable action was that the learner did. I noticed that you XYZ. And then the impact, what ultimately the outcome is of this behavior. And you really want to show a clear linking, so that way there is no potential for being vague, and that a learner really can see your own thought process as to why you've identified this as potentially being an issue. And then the next piece of this is to provide one specific alternative with the feed forward concept, which essentially is saying, next time I want you to try doing XYZ thing. With this, I really counsel you and encourage you to be as specific as you can be, and to give students or learners really one specific thing. We find, and perhaps you found this in your own role as preceptor, that when students have more than one thing to think about, and this is the same for us too as professionals, I'm sure, but when there's more than one thing, we can forget, and it just ultimately ends up crumbling. So the idea with this is to give really one specific alternative. And then the check is basically like the teach back we do with our patients, where we want to make sure that our education has landed on the patient and that they understand. And so when we ask our patient, I know we've talked about a lot of things, would you mind repeating back to me the things we've talked about? The idea is the same with students and learners, to say, okay, now that we've talked through this, what is it that you're going to do next time? And have them repeat it back to you to ensure that they have understood the game plan and that they're on board with what's going to happen next. And then I think it's always a good call to ask them directly, how is it that I can support you in this next endeavor? How is it that I can make your next interaction with the patient better and a more professionally appropriate experience. So at the heart, that's what the feedback is, where you give the situation, the behavior, the impact. You want to be as clear, as descriptive as possible. Give them what they're going to do next time, what you want them to do next time. This really has to be specific. This has to be observable. We talk a lot about SMART goals throughout the curriculum at Western New England. And the idea with the SMART goals is that we really want it to be specific and measurable. And it's going to be the same thing here as well. It needs to be specific, observable, measurable. And then the check, like I said, is to make sure that you check to make sure that they've understood you and that you were clear enough in your directions that it's fair for the student. And then asking how you can support them. So that's the framework. And this, of course, I think goes without saying, but it's a good refresher for us. We want to be specific. We want to be clear. We want to be direct. We want to be kind. And I think students can get quite defensive, especially if they're hearing something that they don't want to hear. But I think if we maintain this thought that what we're doing is to help, the example I think about a lot, I have an older sister, she's a pharmacist, and when she was going through pharmacy school, she's quite a bit older. When she was going through pharmacy school, I think maybe still in middle school, maybe upper elementary school, and she had just learned how to give vaccines. And I remember saying to her, don't you feel bad that you're hurting people, that when you give the injection that you're causing pain? And she said to me, and I really have never forgotten it. She said to me, you have to keep in mind that yes, you're causing a moment of discomfort, but you're potentially preventing them from getting a really bad thing, right? If it's the flu and you're on your bum for 7 days, clutching to the porcelain, the toilet, it's tough. It's really tough. And so she very much had me come to the realization that a moment of discomfort can really prevent so much worse, so many other things that can be a lot worse. And I think feedback is in a kind of similar regard, that it can be difficult to give and it can be difficult to receive, but that's just a moment in time. And then we're potentially helping them avoid so much more in the future that potentially could be uncomfortable. So that's our preceptor promise. That's what we agree to do when we take on learners and when we agree to be preceptors. This is what we've signed up to do. We've agreed to help them learn and help them grow. So I'd like to take some time to practice. So we have scenario one. Timothy is an APPE student on rotation with you. You and he saw a patient with heart failure last week, post-hospitalization. So the patient had just come back from the hospital. And you had discussed following up with the patient this week. It's now Friday. Timothy still hasn't reached out to the patient for follow-up. How can we apply this SBI and feed forward framework? So I'd like to open this to the group. So please feel free to unmute or put things in the chat. I guess we can even start with, do you think that this is inappropriate? Has this flagged for you? Is this something that you would even comment on potentially? And that's okay if you feel that way. You can be honest. Any thoughts?
I feel like I sometimes start with like a question. Maybe there's like a reason why they haven't followed up, or maybe I didn't realize they followed up and they didn't tell me or something, or I missed it. So I usually try to ask and try not to assume that they haven't done it.
Sure. I think that's very fair. Very fair.
But if they didn't, maybe there was a roadblock. So if they self-acknowledge that maybe they didn't do it, and then you can say, well, Why not? Did you not know? Sometimes I feel like I've run into this situation a lot being a new preceptor where I think I'm clear with my expectations and what I expect for them, but it's actually not clear and they didn't realize they had to do something. And then when it comes to the time where they're supposed to do it and pass and they didn't, I asked them why and they're like, I didn't know I had to do that. So sometimes the expectations weren't clear at the beginning.
Yeah. And that comes back to us as preceptors, that maybe we're not being as fair in our expectations if we haven't been clear from the beginning. Sure. Completely agree. Other thoughts? So let's say your student comes back and says, "Oh, I just completely forgot about that guy from last week." How then could you apply the SBI framework? And Victoria, you don't have to feel you're in the hot seat. We can phone a friend too. Other thoughts as a group?
Hi, Maria. I can jump in on this one.
Thank you.
Um, so I think I'd start with something along the lines of, you identified that you didn't follow up that we had discussed last week, or I recognized that you didn't follow up as we had discussed last week. Um, this is what I noticed, and, how could we address it at this point in time? And then ask them what their plan is for addressing it.
Yeah. And and the only piece missing, so thank you. Thank you for speaking up and breaking the ice. What's missing here is the impact. When we know that heart failure is a big deal. We know this. This is not new news. We know that hospitalization and rehospitalization is a very uh common scenario here. And so to miss that follow-up could have real implications for the patient. It could really cost the healthcare a lot of money, could cost the patient a lot of time, effort, money, and health. And so this matters that Timothy has missed the follow-up or has potentially missed the follow-up. And so saying this is the situation, this is the behavior that I've noticed, and the impact is not great for the patient. And it also you're losing trust in the patient, potentially is losing trust in us as the pharmacy team because we said this is what we were going to do and now we haven't done it. And that's not a good look. And so there's so many things that follow-up matters as part of our PPCP. So yeah, great. Thank you. Thank you for sharing. I completely agree with all of that. We have Jane. She's an APPE student on rotation with you. She has provided counseling on an inhaler device for a patient with asthma. The patient required a translator, and Jane spent the entire visit speaking directly to the translator. Thoughts on this? Is that something you would comment on? And if so, how would you do it? We'll open it to the group. Any thoughts?
I don't mind going again because I've also had this exact scenario happen where I had to try and I don't think they realized they were doing it because they were nervous about using a translator and that being a confusing having to like look at the translator and look at the patient because you don't want to ignore the translator either. That's rude. Um, I, s- when I mean, I could have done this wrong, but when I spoke with that student, I asked them again with the asking if there was something that they realized, like how did they think it went? And then when they actually said that they thought it went really well, and I said, I think you did a good job explaining the, discharge counseling very well. I said, but you didn't look at the patient. And I think they just realized that they didn't even need to like they were not even self-aware that they had to even look at the patient and like they didn't even do that. Like they were just looking to the translator. So it was more of like they didn't even realize that they made that mistake in the moment type discovery. But I think again, I feel like in this case, I had the chance to be able to again put expectations that they should look at the patient when they counsel them.
Yeah. And that feedback is a gift. That's something that in theory the learner, your student has learned and won't be doing that again. And so for you to say this is during this appointment, this is the behavior I noticed, and the impact is that the patient probably felt left out, probably felt like they weren't the captain of their own team here and might not come back to you again. And you've kind of interfered with that potential relationship building. And next time, this is what I want you to do. And so to be as clear and direct as possible is going to help ensure that your learner really takes that feedback to heart. And I've certainly seen this out. I'm in primary care. I'm in the Charlton, Mass location, and so we have a number of patients with different languages, and this is absolutely something that could happen in my own clinic site, and I'm sure it's happened elsewhere. So thank you for sharing. All right, so this is something I want to briefly talk about. We started this conversation today, and multiple people mentioned defensiveness. So how do we handle defensiveness? It sounds like it's a pain point for a lot of us across different precepting rotations. So how do you have a way that you found has worked? Or are we all just struggling and there's no real answer that we've found? That could be too. Any thoughts in the chat? I don't know. Anything, Dom?
Nothing in the chat so far, but they might be typing.
All right. I'll give it a quick sec.
I see still struggling in the chat.
Still struggling. All right. It's something we're
Yeah,
struggling with.
definitely something I still struggle with as well. I think most recently I've had success in kind of talking students through why providing you know, what I'd call excuses don't necessarily address the situation to try to handle some of the defensiveness that I've seen. And sometimes that helps kind of redirect the conversation.
Yeah, I think that's fair. I think, and you kind of probably hit it on the head with redirect the conversation. That's what I would probably suggest. And certainly I'm no expert and I'm learning as I go in a lot of ways. But I think some phrases that I found to be helpful thus far, I'm not questioning your intent, just the effects. So this is the behavior that I noticed, and this is the impact that I can see as being an issue. And so I don't think it was malicious, like in the example that Victoria gave us with her student who spoke directly to the translator and didn't even know that, of course, wasn't the intent of the student to ignore the patient. That's not the intent. But the effect of it is there nonetheless. So if that student had come back being defensive, then that's something that potentially you could say and help work. Or let's focus on what we can do differently next time with a little bit of redirection. So it's not, they don't necessarily feel like they're in a hot seat for that long, but that we're now redirecting and putting our time and attention into the thought process for what can we do differently next time and make it better. So
We
with
do
that,
have, oh, I was
oh,
going to share, we have a comment that came
oh,
through
please.
from Amy Mitchell Van Steel, and she says, honest is the best way. I would bring the elephant in the room and say, I sense defensiveness. Why do we have this as an issue between us?
Oh, I like that. I like that. Call it out. Put it, let the elephant stand on his own and ask. I like that. Have you had luck with the student after saying something like that? Maybe.
She might be typing because I know she doesn't have a microphone.
Yeah, I like that. Being honest is a gift. It is.
For what it's worth, while Amy's typing, I am a student of Amy, which is kind of crazy to bring it full circle now being a preceptor on this call. She's great with the honesty. Her feedback is bomb. It's really good. I don't know if I was a defensive student. I don't even remember. I probably was. But she's a good feedbacker and very honest woman.
And it's a skill. It is truly a skill to give good feedback. And I think that's a skill that we're continuing to develop. I'm not sure. Maybe some of us are have an inherent skill that maybe, some of us don't need to practice that much, but certainly I think the majority do. It's not easy to give feedback. All right. Well, in the interest of time, I just want to say I encourage you to try this. This is my email. Please feel free to shoot me an email if you found that you had a real win using this framework, or if you found it to be challenging and why. So please email me. I'd love to hear from you. And with that, I'd like to open it for questions. I do recognize we're right at 12:30, so if you need to go, certainly I won't be offended, but I'll stay on a little bit longer if you have questions for me.
No,
Thank
I
you.
just want to say thank you to Maria for doing this today for us. And I just want to remind you to all of you that as an experiential team, we're here to support you and help you. So we know these tough conversations are hard to have and can be really uncomfortable. So we are here to help with that also. So if you ever need anything or direction on doing that or would like us to step in, always feel free to contact us.
Ditto. Thank you.
Thank you, Maria. Thank you so much.